Cholera is an acute diarrheal illness caused by infection of the intestine with the bacterium Vibrio cholerae. The disease is typically spread through contaminated water and food. Symptoms include severe diarrhea, vomiting, and dehydration. Without prompt treatment, cholera can lead to death within hours due to dehydration and shock. The first cholera pandemic originated in the Ganges Delta in India and spread to Southeast Asia, the Middle East, and East Africa. It caused widespread illness and death, drawing attention to the need for better understanding and management of the disease. The second pandemic from 1829 to 1851 reached Europe, including Russia, and eventually spread to North America. Major outbreaks occurred in cities like London and Paris. The third pandemic from 1852 to 1860 was the deadliest of the 19th century pandemics, affecting Europe, North America, and Africa. It included the devastating outbreak in London in 1854. Originating in India, the fourth pandemic from 1863 to 1875 spread to the Middle East, Europe, and North America, though with less impact than previous pandemics. Industrial cities had inadequate sewage systems and contaminated water supplies, creating ideal conditions for the spread of cholera. The densely populated slums, with their lack of clean water and sanitation facilities, were particularly vulnerable to outbreaks. At the time, the miasma theory, the belief that diseases were caused by bad air, was widely accepted, hindering effective measures to control cholera. London experienced several severe cholera outbreaks, with the 1854 outbreak in Soho being particularly notable due to Dr. John Snow's investigation. New York City also faced repeated cholera outbreaks, exacerbated by similar issues of sanitation and overcrowding. During the 1854 outbreak in London, Dr. John Snow, a physician, conducted a groundbreaking investigation. He mapped the cases of cholera and identified a cluster around the Broad Street water pump. Snow hypothesized that cholera was spread through contaminated water, not miasma. He famously had the handle of the Broad Street pump removed, after which the outbreak subsided. Snow's work is considered one of the founding moments of modern epidemiology. It demonstrated the importance of data collection and analysis in understanding and controlling disease transmission. In 1842, Edwin Chadwick published a report highlighting the unsanitary conditions in British cities and their impact on public health. His work helped to galvanize public health reforms. This act established the General Board of Health in Britain and laid the groundwork for improving urban sanitation, drainage, and water supply systems. Engineers like Joseph Bazalgette in London designed and built extensive sewer systems to carry waste away from urban areas and improve water quality. Advances in water filtration and chlorination further reduced the incidence of waterborne diseases like cholera. Improved sanitation, better sewage systems, and cleaner water supplies led to a significant reduction in cholera outbreaks in the latter part of the 19th century and into the 20th century. The cholera epidemic spurred the development of public health infrastructure and practices. The establishment of public health departments, improved medical knowledge, and the creation of health regulations were direct outcomes of the cholera crises. Despite the advances, cholera remains a threat in regions with inadequate sanitation and water infrastructure. Modern public health efforts continue to focus on improving these conditions to prevent outbreaks. The history of cholera during the 19th century highlights the interplay between disease, urbanization, and public health. the devastating impact of cholera outbreaks underscored the need for better sanitation and clean water, leading to significant public health reforms. Dr. John Snow's pioneering work in epidemiology marked a turning point in the scientific understanding of disease transmission, laying the foundation for modern public health practices. The lessons learned from the cholera epidemics continue to inform efforts to combat infectious diseases worldwide.